Atorvastatin side effects, and how to manage them. Atorvastatin, widely known by the brand name Lipitor, is a statin medication prescribed to help lower cholesterol levels and reduce the risk of heart attack or stroke in people at higher cardiovascular risk. When taken as directed, ideally at the same time each day, it can be an effective and important part of your treatment plan. However, like all medications, atorvastatin can cause side effects in some individuals. If you notice any changes while taking it, you may be wondering how to manage them without compromising your heart health. Below, we'll explore some of the most common atorvastatin side effects and practical ways to address them with your healthcare provider's guidance. 1. Muscle pain. Muscle pain, especially in the calves and thighs, is among the most frequently reported side effects of atorvastatin. Research suggests a slight increase in risk for muscle discomfort during the first year of treatment, but many cases may not be directly caused by the medication. If muscle pain occurs, it often improves over time. Should it persist or become uncomfortable, your prescriber might recommend lowering your dose, adjusting your dosing schedule, taking a short break, or switching to another statin. Never stop or change your medication without medical advice. 2. Joint pain. Some people taking atorvastatin may experience joint pain. In certain cases, this discomfort could be due to arthritis rather than the medication itself. Individuals already living with arthritis sometimes report worsening symptoms after starting atorvastatin. If joint pain is mild, it may fade with continued use. Over-the-counter pain relievers might help temporarily, but ongoing or severe discomfort should be discussed with your healthcare provider, who can adjust your treatment plan if necessary. 3. Common cold-like symptoms. Runny or stuffy nose, sneezing, and sore throat have been reported by some people taking atorvastatin. These symptoms are usually linked to viral infections, such as a common cold, not the medication itself. Colds typically resolve without antibiotics, but over-the-counter remedies can help ease symptoms in the meantime. If your symptoms are severe or do not improve within 10 days, consult your healthcare provider for further evaluation. Understanding atorvastatin side effects and how to manage them is key to staying on track with your cholesterol treatment. In most cases, side effects are temporary and manageable, especially with open communication between you and your healthcare provider. This ensures that you continue to protect your heart health while minimizing discomfort. 4. Diarrhea. Diarrhea is a possible side effect of all statin medications, including atorvastatin. Similar to muscle and joint pain, this symptom often improves over time. Making certain dietary adjustments can help. For example, avoiding fatty or fried foods may reduce diarrhea and also support your cholesterol goals. Staying well hydrated is important to prevent dehydration. If diarrhea is persistent, severe, or interfering with your daily activities, speak with your healthcare provider for further evaluation and management. 5. Upset stomach, indigestion, and nausea. Stomach-related side effects such as nausea or indigestion may occur while taking atorvastatin. Several strategies can help reduce these symptoms. Take your dose with food. Although atorvastatin can be taken with or without food, pairing it with meal or snack may help if you experience stomach upset. Avoid spicy or fried foods. These can worsen nausea. Choosing bland, starchy foods temporarily may be gentler on your stomach. Take your dose at bedtime. This may allow you to sleep through any discomfort. Consider an over-the-counter remedy. Your pharmacist or prescriber can suggest suitable OTC nausea treatments. Prescription options are available if symptoms persist. 6. Liver damage. Although rare, liver damage has been reported in some people taking atorvastatin. Possible warning signs include dark urine, stomach pain, yellowing of the skin or eyes, and loss of appetite. In many cases, liver changes are mild, temporary, and detected only through routine blood tests. This is why follow-up appointments are important during treatment. Higher doses of atorvastatin, heavy alcohol use, or a history of liver problems can increase the risk. If abnormal liver tests occur, your healthcare provider may lower your dose or adjust your treatment plan. 7. Blood glucose changes. Atorvastatin may cause small increases in blood glucose levels, which could raise the risk of developing type 2 diabetes in certain individuals. It can also slightly worsen blood sugar control in people who already have diabetes. Despite this, medical experts generally agree that the cardiovascular benefits of atorvastatin outweigh this risk, particularly for individuals with diabetes, as statins can significantly reduce the likelihood of heart attack and stroke. If you have diabetes or are at higher risk, your prescriber may recommend more frequent blood glucose monitoring during your treatment. 8. Severe muscle damage, rhabdomyolysis. Although extremely rare, atorvastatin can cause a serious condition called rhabdomyolysis. This occurs when damaged muscle tissue breaks down, releasing harmful substances into the bloodstream. Symptoms can include severe muscle pain, dark or reddish urine, weakness, and unusual fatigue. If you notice these symptoms, seek medical attention immediately. The risk of rhabdomyolysis is higher if atorvastatin is taken alongside certain medications, such as erythromycin, Aritab, or itraconazole sporanox. Always keep your healthcare team informed about all the medications and supplements you take, so they can monitor for potential interactions. 9. Kidney damage. Kidney damage from atorvastatin is uncommon and typically results from untreated rhabdomyolysis. When muscle breakdown products accumulate, they can block the kidneys, leading to kidney failure. Kidney failure from rhabdomyolysis can progress quickly and become life-threatening if not treated promptly. If you experience symptoms of rhabdomyolysis, seek urgent medical care to prevent serious complications. 10. Memory problems. Some people have reported memory issues while taking statins, including atorvastatin. However, current research does not strongly support a direct link, and some studies even suggest that statins may reduce the risk of dementia. If you notice memory changes, discuss them with your healthcare provider. They can help determine whether atorvastatin is a contributing factor. Most reported cases of memory problems related to statins have been reversible. 11. Hair loss. Hair loss with atorvastatin is uncommon, but it has been reported. It's important to remember that hair thinning can result from various factors, such as stress, underlying health conditions, aging, or genetics. If atorvastatin is the cause, the hair loss is usually temporary, and hair often regrows after stopping the medication. However, you should not discontinue atorvastatin without medical advice, as its benefits typically outweigh the risk of the side effect. Your healthcare provider can help identify the cause and recommend treatments if needed. 12. Chest pain. While muscle discomfort from atorvastatin often affects the legs, it can occur in other areas, including the chest. Rarely, chest muscle pain has been reported in statin users and resolved after stopping the medication. Because atorvastatin is prescribed to lower the risk of serious heart problems, any chest pain should be treated as a medical emergency until proven otherwise. Heart attack symptoms can include chest pain radiating to the arms, neck, or jaw, shortness of breath, sweating, and nausea. If you experience chest pain, seek immediate medical care. If atorvastatin is identified as the cause, your healthcare provider may lower your dose or switch medications. 13. Headache. Headaches are possible while taking atorvastatin, though the risk varies among individuals. Some studies report headaches in about 1/3 of statin users, while others suggest statins might reduce headache frequency in people with adequate vitamin D levels. If headaches develop after starting atorvastatin, they often improve with time. Staying hydrated, practicing stress management, maintaining a healthy sleep schedule, and engaging in regular physical activity may help. Over-the-counter pain relievers can also be used if approved by your healthcare provider. When to contact your healthcare team about atorvastatin side effects. If side effects from atorvastatin begin to interfere with your daily life, it's important to reach out to your healthcare provider. In some cases, the symptoms you're experiencing may not be caused by atorvastatin at all, and your provider can help determine the true cause and the best way to address it. While uncommon, serious side effects can occur. Seek immediate medical attention if you notice symptoms such as dark-colored urine, severe muscle pain, or reduced urination. These may indicate potentially serious conditions that require prompt treatment. If you find it difficult to tolerate atorvastatin, do not stop taking it without medical guidance. Your prescriber can suggest strategies to help you continue your cholesterol treatment safely. These may include lowering your dose, adjusting the time of day you take your medication, or switching to a different statin that's better suited for you. Takeaway: Atorvastatin is a highly effective medication for lowering cholesterol and reducing cardiovascular risk, but like any treatment, it can cause side effects. Knowing what to expect and when to seek help ensures you get the benefits of therapy while minimizing potential discomfort. Stay informed, stay healthy. For more clear, science-backed explanations on medication side effects and ways to manage your health, subscribe to the HeInfo channel, your all-in-one destination for trusted, evidence-based health information. Like this video if you found it helpful, subscribe for more health insights, and comment below with your questions or experiences so we can continue the conversation.